You and your significant other have just spent countless hours in the birthing suite, pushing through contractions to bring a healthy newborn child into this world. The baby begins to cry. Meanwhile, the nurses are drying your baby off, and the doctor says it's a boy. They place the baby on your chest. The baby's crying, but so peacefully. Your doctor comes back and asks, "Are you going to want your child circumcised?" He tells you some general information about the procedure, but does he really tell you the important things you need to know before making the decision? Infant male circumcision is the surgical removal of the skin protecting the glands at the tip of the penis, resulting in permanent alteration of the anatomy and the function. The majority of the neonatal circumcisions in the United States are performed by OB/GYNs after delivery and before the child and mother can leave the hospital. The baby boy is strapped down with Velcro restraints to a molded plastic board called a circumstraint, specifically designed to hold them down. Here is an example of a circumstraint board with the Velcro straps for their arms and legs to keep them held down. During the procedure, forceps grasps the foreskin and widens the opening of the penis. Next, a metal probe is inserted beneath the foreskin and is moved circularly to detach the foreskin from the glands. A slit is then cut into the top of the penis. And lastly, an instrument, a Gomco clamp or a Plastibell, is placed over the penis, and a circumferential incision amputates the foreskin. These pictures here, this is an example of a Gomco clamp, and this is a Plastibell, the two ways of using the procedure. It is the most commonly performed surgery in the United States, and as of 1998, there are on average 3,300 performed a day. Now that I've explained what infant male circumcision is, I'd like to discuss why it's beneficial to keep your son's foreskin intact. Circumcision of infant males removes a functional part of the body. Too commonly, the foreskin is referred to as extra skin, when in reality, foreskin has at least 10 main functions: to cover and permit the development of the mucosal surface of the glands and inner foreskin, to protect the infant's glands from feces and ammonia in their diaper, to protect the gland's penis from friction and abrasion throughout life, to lubricate the glands, to coat the glands with a waxy protective substance, to provide significant skin to cover the erection by unfolding, to provide an aid to masturbation and foreplay, to serve as an aid to penetration, to reduce friction and chafing during intercourse, and to contact and stimulate the G-spot of the female partner. This procedure removes 1/3 of the penile skin system. Removing the foreskin removes 20,000 nerve endings and 3 feet of veins, arteries, and capillaries. The amount of skin removed from an infant's penis may not seem like much, but compared to the amount of skin they will have as an intact male later in life is shown by a 3x5 index card. And here's an example of a 3x5 index card, the amount of skin that would be removed as an intact male. Now that I've informed you about circumcision as removal of a functional body part, I will go on to explain why circumcision is not medically necessary. Many people are told that circumcision is said to decrease the risk of urinary tract infections, phimosis, which is the inability to retract the foreskin at the age of puberty, glandinitis, which is the inflammation of the gland's penis, and penile cancer. However, they may not know that the chances of acquiring these conditions are very slim. Less than 1% of males will require circumcision for medical reasons. In developing countries, penile cancer will develop in about 1 out of every 10,000 males, or 100,000 males, and is dependent on many factors, including sexual behaviors, so it is not very likely. The risk for acquiring a urinary tract infection from males is less than 1%, compared to that of women who are 4 times more likely to get a UTI than the intact male. The treatment for these medical conditions is not circumcision. Urinary tract infections can be treated with antibiotics, and glandinitis and phimosis can be treated with a topical cream. Leaving the foreskin intact suggests decreased infections, actually. There's a soft mucosal layer that protects the urinary tract from contaminants. Considering we don't remove ears to prevent ear infections and eyelids to prevent infections of the eye, foreskin should not be removed to prevent infections of the penis. As with all medical procedures, there's always the chance of experiencing complications. Immediate complications include the removal of too much or too little foreskin, difficulty breastfeeding, loss of function, adhesions, partial amputation of the glands, painful urination, infection, and sometimes death. These complications can occur in up to 20% of circumcised males. Long-term complications include painful erections, decreased sensitivity, curvature of the penis, impotence, and chafing all throughout life. It is significant to note that the United States is the only country in the world that routinely circumcises most of its newborn infants for reasons other than religious beliefs. Here's a table showing the countries that say no to circumcision and do not practice routine medical infant circumcision unless they're for religious reasons. And the U.S. is one of the few countries that is not on that list. Since circumcision is not medically necessary, parents should be sure that they are educated on the subject properly before making such an important decision for their child. Circumcision is the only operation where the decision to operate is made solely by non-medical personnel, the parents, acting with little or very incomplete knowledge of the procedure. When it comes to male circumcision, those with higher education usually report a lower rate of consenting. Parents that lack knowledge on circumcision commonly do not understand the pain the procedure causes to the child. In 1987, the American Academy of Pediatrics stated that local anesthetics are available and considered relatively safe for children. However, the availability and education of pain management doesn't guarantee that the proper action will be taken to relieve the pain. A study in Rochester, New York confirmed that while 97% of medical students were instructed to always give pain medication prior to the procedure, only 84% were compliant. No method of pain control available for circumcision is able to provide 100% relief for the child. The easy availability of circumcision makes it easy to consent to without giving it much thought. Currently, circumcision is legal and covered by most insurance companies. Although health insurances, specifically Medicaid and Blue Cross Blue Shield, are reconsidering their financial support because it was deemed unnecessary. With the pressures to reduce state taxes and many demands on insurance companies for covering this procedure, Medicaid is looking at a cost-benefit analysis. With many health organizations declaring the procedure medically unnecessary, including the American Academy for Pediatrics, American Medical Association, American Cancer Association, and the American College of Obstetrics and Gynecology, cost-effectiveness for insurances was evaluated. It was determined that over $500 to $800 million are spent on circumcision per year. As a result, 16 states have decided to withdraw their financial support for circumcision. In this speech, I explained what infant male circumcision is, how the procedure removes a functional part of the body, and is not medically necessary. I also discussed the importance of being educated when making such a decision. In the time it took me to give this speech, approximately 45 infants were circumcised in the United States. The information I gave you today was gathered from several different sources. One of the scholarly sources, an article called Circumcision and Informed Choice, was written by a nurse. My second scholarly source, an article called Involuntary Circumcision, The Legal Issues, was written by doctors from the Medical College of Wisconsin, Department of Pediatrics. I referenced from 2 books that were written by medical doctors that have lots of experience in their field of pediatrics. Thanks.